All right. So now that we have gone over some other practice questions, let's go for genitourinary in this section. Let's go over some GI or gastrointestinal practice questions. And these questions are really here not to necessarily tell you exactly what you need to know for the exam, even though you are going to hopefully gain some content or understanding of the information from this, but they are more so to help you learn some test taking strategies, approaches to questions. Because, as much as there are some students who maybe do not study enough or get the content enough, majority of the time, what's missing is something about the way you're looking at the question, interpreting the question, or approaching the question. So hopefully this is helpful. So let's dig right in. Question number one. It says a client is receiving parenteral nutrition via a central line. Which assessment finding is most concerning? So first, let's break down this question. So it's saying that they're receiving parenteral nutrition. So I need to know what parenteral nutrition is. And it also is telling me specifically that it's being given via central line. And, there is sometimes we put information in a question that's not important, but when it's a shorter, like usually the questions where there's extra information or like kind of like case study questions where there's a bunch of like little details, in a shorter question like this, usually every part's important, not always, but I'm going to kind of like keep that in the back of my mind that that's probably something that I need to take into consideration. It says, which assessment finding is most concerning? And so this question, what it's asking me, since it's saying most concerning, it means that some of this, like all of this might be concerning. Some of it may be concerning, some may not, but I have to look at what do I need to report right now? Or what if I do not do something about, there could be a serious complication or death. So looking at my first answer choice, it's saying blood pressure 143/77. So that's obviously high. I don't really like that, but no alarm bells are ringing in my head quite yet. Blood glucose 178. So that's high as well. And then I have to think about, because a lot of times when they're asking a most concerning question, the thing is that some of the things are expected. So I have to say, am I expecting that they're going to have a higher blood glucose with parenteral nutrition or TPN? That's what that is. Yes, I am going to expect them to have a higher blood glucose. It doesn't mean I don't need to do something about it, but it's not that high, and we'll kind of see. I'm gonna keep it on the back burner. It's kind of like the blood pressure. Don't really like it, but it's not the end of the world. Temperature of 101. I don't really like that. I don't really like that because it's a sign of an infection. And if they have a central line, then that's going to be really no bueno. Like I'm going to be really worried about them having a central line infection, which could be a systemic infection for them. So that's kind of already like standing out as maybe one of my top choices. And then I have potassium 3.7. And so if I know my electrolytes, that's a normal potassium. So I can already cross that one out. So I've got A and B, which are both like pretty good answers. Like they have something that's going on that I need to do something. But, if I didn't intervene for a little bit, they could still be okay. But when I'm looking here at the temperature of 101, that's super concerning because it could be a sign of a complication. Because really what this question is trying to get from you is it's trying to see if you recognize what are the complications of getting parenteral nutrition via a central line. And infection is one of the biggest complications that we're concerned about. And that is correct. That C is the right answer. So question number 2. It says a nurse is caring for a client with appendicitis. Upon assessment, the client is found to be having increased abdominal pain, rebound tenderness, and they vomited 500 mLs of gastric fluid. What should the nurse do first? So I don't think we've gone over a question quite like this before. It's telling you about what the patient has. You always need to think, okay, what is this disease process? Because sometimes the right answer, like we have answers that are correct for similar disease processes, but not for this one. Okay, appendicitis. I have to start thinking about what does that look like or what's normal for that. And I'm already seeing some other cues here. They're saying they're having increased abdominal pain, which means something's getting worse. Something is not normal. Rebound tenderness, and they vomited recently. That seems like a lot of fluid too. So there's something that's not right here. So there's some sort of problem. So it says, what should the nurse do first? The first question I need to ask myself is, am I trying to maintain something? Because sometimes we can ask a question like this and it's just really like, hey, they're okay, but what's most important? But this question, obviously there's something that's not right going on here, and I need to figure out what do I need to do. And so this is kind of like the last question where we have to ask ourselves, okay, if something's not right, which of these, if I don't do it, it could lead to death the quickest for the patient? Like which of these is most important to do or is going to have the most direct or best effect for that patient? So let's look at our choices and kind of see what's going on here. So it says call the physician immediately. So anytime I see in an answer choice, call the physician immediately, that means that I need to decide. This is like anytime you see that as an answer choice, you first need to go back to the question and you need to decide, is the patient stable or not? Because this is a big thing. This is that anytime there's an answer choice that's an option for call the physician immediately means like I either need to, one, do something as the nurse first and then call the physician, or this is an emergency, there's nothing else I can do as the nurse, or if I wait, it's going to delay care and that patient could die. So I have to decide like where we're at. And so far, like, I mean, if I have to know appendicitis well enough to know like, hey, is this normal or not? And this seems like they're having worse abdominal pain, rebound tenderness, which if I knew what that was, or if you knew, I should say, if you know what that is that it's where they effectively, like when you push down on their abdomen and let go, they have tenderness, which is a sign of peritonitis, which is life or death emergency. And then it says they vomited 500 mils of gastric fluid, which is another sign of peritonitis and severe issues here. So I'm kind of leaning towards calling the physician, but I need to look at my other choices, because if I'm going to choose to call the physician, it means there's nothing else that I as the nurse can do. There's nothing else I need to assess for first. I have all the information I need to call the doctor. And it also means that there's nothing that I need to do immediately before calling that doctor in order to save this patient's life. So then I have to ask myself, so I'm looking at B, it says administer morphine 2 milligrams IV push. Well, they're having, increased abdominal pain, and I'm a very kind, considerate, compassionate nurse, and I want to give that pain medicine, but is giving that pain medicine going to delay them getting life-saving treatment? Or in other words, it is the other way you could look at it is giving the morphine going to help to save them before I call the doctor? And I don't think that it's going to help, but let's keep going. So then it says administer ondansetron 4 milligrams IV push. And if you know what that is an antiemetic. So your other key here is there's 2 medications there. Anytime there's 2 medications, either one of them sometimes is right or they're both wrong. So because if I'm going to use the rationale that there's no medication that I need to give first before calling the doctor because there's nothing else I can do as the nurse, if the morphine's not correct, then the ondansetron can't be correct either. So sometimes you can look at it both ways. And then sometimes alternatively, and I'm sure I have other questions that are like this when you're looking at this, sometimes they want you to know your meds and they want you to know which one's important. But right now, remember, think of the kind of question this is. This is a question that's saying, hey, is the shit about to hit the fan? Like you need to do something right now? Or are you okay to do an intervention first or to assess something first? And there's no options in here to assess. But remember, like I said, the key there, what you always need to ask yourself, is there any assessments or information I need to gather before calling the physician so they're not like, okay, sounds like something's not right. Tell me this assessment finding. And I'm like, oh no, I didn't look at that. I just called you. I want to make sure I have all the data, but there's no option to assess here. It looks like it's either I need to intervene or call the physician first. The last choice is reposition client to the right side lying position. So, there is like with appendicitis, we do talk about, I believe it's the left side lying position, and flexing the knees can relieve pain. But right now, that's more for comfort when they're stable versus that I'm in an unstable position right now based on everything that I can read in the question. So the best answer is going to be A in this case, that none of the rest of these choices are something that that I need to do first before calling the physician. So A would be correct. Everything else would just delay care and could lead to, they can have rupture, peritonitis, perforation, and then lead to death. So we definitely want to call immediately so they can have that appendix taken out. All right. Question 3, a nurse is caring for a client with suspected inflammatory bowel disease. Which statement, if made by the client, is most indicative of Crohn's disease? So this is a question that is asking about, pretty much is asking you to identify like what signs and symptoms or manifestations are common with Crohn's. It's kind of a backwards way of asking it. Effectively, what it wants you to identify is, if I was taking care of a patient, I was like, hey, this sounds like they might have Crohn's disease, which like sometimes it might ask you what question to ask, or other times it might ask you what statement sounds most like Crohn's. So that's effectively what this is asking is, which one of these sounds like Crohn's? And if you know anything about inflammatory bowel disease, pretty much this question is probably going to either have something that looks similar to ulcerative colitis, which is similar to Crohn's, or it's going to have other gastrointestinal disorders. So in other words, I need to know kind of like what is really hallmark or characteristic of this disease. So A, I have a burning in my chest after I eat. Well, that sounds like gastroesophageal reflux. So I can kind of see where whoever wrote this crazy question might have been thinking about in her answer choices, that she might have been thinking about putting similar diseases, but maybe not necessarily the same one. I have lost 10 pounds in the last month. Well, I do know with Crohn's that they can have weight loss associated with the fact because they have this patchy inflammation in their bowels. And so that they can lose weight because they're not absorbing things as well because their bowels are all inflamed. So that's possible. But I also have to go back to the question. It says most indicative, which means which one is the best. It doesn't mean that some of these or all of these might apply, but which one is like most, like when I look at it, I'm like, hey, if they're saying this, then it's probably most likely related to that. C says, I have pain in my right lower quadrant. And then D has, I have a mass in my left lower quadrant. So this is kind of seeing if I know where the pain or the problem is going to be. And this is something key when you're studying for GI is you need to know what's going on in your quadrants. So pain in my right lower quadrant is appendicitis. So I don't think it's that. And then I have a mass in my left lower quadrant, and that is more related to diverticulitis. So it sounds like probably the best answer is going to be B, which it is correct. By the way, I get all these answers right, but it's because I wrote these questions. So B is the best answer here, as it's going to be most indicative of Crohn's disease out of all these choices. Now, you may be telling yourself, well, that's not really a great statement. A lot of things can cause you to lose weight. That's true, but you always have to look at your answer choices. And I can't tell you how many times I've talked to students and they've been like, yeah, I didn't choose this answer because I didn't like it. I thought there was a better answer out there. And they chose one that was super wrong because they just didn't like the ones that were right, but they were like the answer they wanted. So don't always go with just the answer you heard your professor say a million times that you're your head, you read the question, and you're like, oh my God, it has to be this. Sometimes it's not, and that's okay. Question 4, a client is being discharged with an ileostomy. Which teaching should the nurse include with discharge education? So there's no crazy situation going on here. This is a teaching question. They're being discharged with an ileostomy. And it's just saying what should I include? So it's not even saying what's most important, what's priority. It's just asking me simply what's to be included, which means one answer here is right, the rest are wrong. So I could take this like a true false and go down and be like, okay, this is true or false. Which one's right, which one's wrong? So it says, ensure you consume a high fiber diet. Well, that sounds pretty good. High fiber always is generally good. I don't know though if it's going to be good for an ileostomy. So I'm going to kind of keep it on the back burner and we'll see. Sleep with head of bed elevated at home. Well, that seems a little unnecessary. It's not a respiratory problem, and it's not a problem with, they're not getting fed through it. So I don't really see why that would be pertinent. So I'm going to cross that one out. Fluid intake will increase your diarrhea. So it's saying, like, pretty much saying, is fluid good or is fluid not good? And I think I remember with ileostomy, we want more fluid because they're going to be losing more fluid. And so with ileostomies, it's mostly liquid stool, if I remember correctly. So I think fluid is good. So I'm going to say that that's not correct. It says you need to wear your pouch at all times. Well, thinking about where an ileostomy is, this seems to make sense, like that you would want them to wear their pouch at all times because otherwise they're going to be leaking stool all the time. So yeah, so I'm thinking D might be the right answer, but then, so let's say I'm down to 2, I'm down to A and D. So then I have to I'm going to think it through. So if I'm telling them to consume a high fiber diet, and this is a person who's losing liquid stool pretty regularly. If I go back and I remember what some of my problems with ileostomy are, I might remember that they have a lot of fluid and electrolyte imbalances, or they can. So we don't want them to have too much stool. So while we want them to have good fluid intake and we want them to obviously have a good diet, we don't want them having so much that then they're going to be like losing a lot of fluid and electrolytes, and we're going to be constantly chasing it. So based on that information, I'm going to go with D, you need to wear your pouch at all times. That is the correct answer yet again. 4 for 4 so far. All right. So question 5. Ooh, a medication question, your favorite. A nurse is preparing to administer metoclopramide to a client. What is the expected outcome of this medication? So this is a great kind of question to go over strategies for, because this one students really struggle with. Because the thing is when you guys study medications, you tend to study, the name of the medication, side effects, maybe some of the teaching, but a lot of times you don't always focus on what's the expected outcome. So for example, let me give you another for instance. So let's say I said, what's the expected outcome of furosemide? Well, it depends on who it's for. We call it, but and this one doesn't say what the condition's for, and a lot of times that's going to make the difference. Let's say I was saying furosemide for heart failure. The expected outcome is going to be that their lungs are clear, they have decreased edema in their legs, etc., decreased work of breathing, that kind of stuff. That's what I'm expecting, because it's going to take fluid off of them and allow them to breathe better and to have less edema. Now, a lot of students would say the expected outcome is that they're peeing a lot. And I mean, that's what's going to happen as an expected effect of the medication, but that's not the outcome I'm hoping for. So when you see the word outcome, this is saying, what am I hoping to achieve? Or if this medicine worked exactly as it did for this specific client, what would I be hoping for? And so this one, since it doesn't say what kind of client it is, I just have to know what metoclopramide does. And it's really asking, what does metoclopramide do? And if you don't know it, it is a motility agent. It helps to get things moving. And so it helps, if people are having a lot of tube feed residuals, maybe their residuals will go down, or if they were having trouble with constipation, they would able to it's not really a med for constipation, but it can help to get things moving. We use it in diabetic gastroparesis to help get pretty much the intestines squeeze in to get food moving along. But anyway, let's kind of look, going in with that knowledge, let's look. So it says client states they're having less frequent stools. Well, that kind of goes against what I just said. That sounds like the opposite. And this is common. Often in an outcome question, I'm going to put what the correct answer is and then the opposite as well. So I don't want them they shouldn't be having less frequent stools. They should be having more frequent stools. Client states their nausea is improving. I'm going to hold on to this one because I think it can be used for nausea too. Client states their appetite is increased. Well, I don't think this has anything to do with increasing appetite, so I'm going to cross that one out. It says client states their stools are softer. So this kind of sounds like, if you thought hey, this is going to help with motility, this one sounds good, but you have to look at what it's specifically saying. It says client states their stools are softer. This is not saying that they're having more frequent bowel movements or anything. And I didn't say metoclopramide was a stool softener. I said it helps you to have better motility so you can push it out, but it doesn't change the formation of it. It doesn't change whether it's soft formed, hard, etc. It merely just causes you to move things more. Whatever you've got, you're going to move it easier, but it's not going to necessarily help you to have softer stools. So for this one, B has to be the right answer, and it is correct. Effectively metoclopramide, it is used to help to get food and stuff moving through the GI tract, but it also, in that because a lot of times with nausea there's you're retaining stuff, it helps to get that moving, which can help with nausea. So B is the correct answer here. Question 6. A nurse is caring for a client who had recently had a Roux-en-Y gastric bypass. Which teaching will the nurse need to include for this client? Select all that apply. Ooh, one of my favorites. All right, so if you remember our strategies for select all that apply, we always want to go in and make sure we're just doing true, false, straight down, not playing any games, not trying to figure out, is it this many, etc. And we need to first establish, what's this question asking me? Is it asking is it really true, false, or is it asking for priority? What is it referring to? So they had a Roux-en-Y gastric bypass. So that's a surgery. So I'm either looking at things that I want to do immediately post-operatively, or when they're going home after having a weight loss surgery. And it just says, what teaching will the nurse need to include? So this just is a true, false. It's not saying what's most important. It's just saying what needs to be included. So this is either it's right or it's wrong. So first choice, treatment for pernicious anemia. Oh man, this professor's really trying to test us, isn't she? All this all this terminology that she's thrown in these questions. So I would have to know what pernicious anemia is, and know if someone who's had a gastric bypass is at risk for it. And if I remember correctly, pernicious anemia happens to anyone who's had a loss in any part of their stomach, like they have less stomach tissue, because in your stomach tissue you make intrinsic factor, and intrinsic factor allows you to absorb vitamin B12 into your bloodstream. So what pernicious anemia is a vitamin B12 deficiency. So if someone has had a gastric bypass, and specifically a Roux-en-Y, and this is, if you remember, this is the surgery where they cut out half of the stomach and then they shorten the bowel too. So it's considered a restrictive and malabsorptive type of surgery, where we're restricting how much food they can get in their stomach, and then we're shortening the amount of absorption they're getting of their nutrients. So does that apply here? Absolutely. So I'm going to go A is yes. So yes, I will want to include that. B, need for long-term anticoagulation. Well, if I had a professor who was like really nerding out about cardiac, she probably would have told me a few times that there's only 2 patients that need long-term anticoagulation. And she probably would have said, atrial fibrillation, or if they actually have a blood clot. And does any of this have to do with that? And sadly, GI doesn't have a lot of cardiac in it. It's really sad. I like the electrolyte disturbances and stuff that may cause some dysrhythmias and nausea and vomiting. But yeah, that's all I've really got for GI when it comes to cardiac. It's a shame. Anyway, so I'm going to say no. I do not think they'll need long-term anticoagulation. C says aim for 6 small meals throughout the day. Now, this is something that you're going to see a lot in GI, and a lot of people, they should have 6 small meals throughout the day. But, as a whole, it is a fallacy sometimes where some students can get kind of caught up in like, oh, that sounds really good. Like, that's really good for everybody. Everyone should do that. But is it pertinent to this patient? So a patient who's had a Roux-en-Y, like I said, they've had half their stomach cut and they're not absorbing as much. They're not going to have as much room to intake. So having 6 small meals throughout the day, that actually sounds really great. So I'm going to say yes. All right. Increased protein intake is key. This is pretty good, because I know that a patient, like I just said, like C is really good for the fact that they have half their stomach cut, so their stomach's smaller, so they can't absorb, they can't get as much into their stomach. But D is talking about increased protein, and if I'm not absorbing as much because I have less intestine after a gastric bypass, I bet protein intake is key, because I'm going to need to build up as much strength and muscle as I can. So I'm going to go with D as well. It says signs and treatment of dumping syndrome. So then I have to know, what is dumping syndrome? This professor, with all of this terminology, man, this is a really hard question. Thank goodness it's not on your actual exam, right? This is also, I think, going to be true, because with dumping syndrome, that's where you have a change in your absorption of nutrients that leads to like the dumping of a sudden dumping of nutrients from the stomach into the intestines, and the body gets overwhelmed and reacts. So I believe because of the changes they have in the surgery, that's going to be correct. I can talk. And then it says increase fluid intake with meals. Well, I told them already to have small meals throughout the day. And this is something else that I usually do not recommend comparing answers, but if you're ever kind of stuck and you're like, I don't know, make sure your answers don't contradict each other. And so like if I'm telling them to have small meals, but then increase their fluid intake, I don't know. They don't have a lot of room in their stomach for a lot of stuff. I think increasing their fluid intake would lead them to getting full up on a bunch of fluid versus the high protein and small meals that they need. They're not going to get the nutrients they need. So I think if I remember correctly, I want them to have fluid in between meals, not with meals. They do need good fluid intake, but just not with meals. So that leads me to having correct answers of A, C, D, and E. And that is the correct answer. Hope you got this, Sado, like me. All right, last but not least, a nurse is caring for a client with gastroesophageal reflux disease, also known as GERD. After lunch, the client states they're having 4 out of 10 chest pain. What is the most appropriate intervention? All right, so let's break this down. So first, I'm taking care of a patient that has GERD. All right, got it. It says after lunch. So anytime it's telling you about time or a situation, you have to always keep in mind what happens after lunch for people with GERD. All right, I'm kind of thinking about it. It says the client states they're having 4 out of 10 chest pain. I don't like chest pain. I love chest pain because I'm a cardiac nurse, but I don't like it for my patient. 4 out of 10 chest pain. Now that's not a lot of pain, but it's definitely some pain. It says what is the most appropriate intervention? So this means that there might be, some of these might be appropriate, but what's the most appropriate? What's going to be most helpful or most directly going to help solve this problem? All right, so A, Tell the client it is expected and to report if it gets worse. Well, that doesn't seem very nice. Hey, you're having 4 out of 10 chest pain. I'll be back in 30 minutes to check to see if it's gotten worse. Doesn't seem very therapeutic or helpful, and we don't really ever ignore chest pain. So, all right. So I'm gonna say no for that one. B, call a rapid response team member to come evaluate. So this is like pretty much, instead of calling the physician, we could call someone, like if it was like an emergency in the hospital. So this is pretty much saying, is this an emergency? And so then I have to ask myself, kind of going back, I have to ask myself, after they eat a meal, is someone with GERD have chest pain? Is that expected? Well, I think it actually is expected. This doesn't seem like an emergency. They're not having 10 out of 10 chest pain. They're not having EKG changes. They're not having like shortness of breath or any other associated symptoms. So I don't think that's going to be the right answer. So I'm going to cross it out. Check the client's apical pulse for rate and regularity. Well, I love a good apical pulse check, but I don't really know how it's necessarily going to help. So it's pretty much asking me now, okay, well, do I need to assess something else? Or am I going to treat them? And so assessment, maybe like if there's anything else I need to assess, maybe I could, like, if I was going to assess something, I would maybe check like an EKG or something like that. But I don't think that I necessarily, assessment's going to be my first priority. Let's kind of see what's next. Administer their PRN order of calcium carbonate. And if you know what calcium carbonate is, it's an antacid. So I have to ask myself then, is this probably what's going to best help them? So if I have reflux, I have too much acid going into my esophagus after a meal, is an antacid going to help? It sounds pretty good, right? And this is generally in real life what we do. Like, if someone's complaining of like, oh yeah, I'm getting my chest pain after I ate a meal. A lot of times we'll give them a calcium carbonate, which is Tums, something like that, and see if it improves. Now, if it doesn't get better, or if they are having EKG changes, other things like that, then I'll definitely need to evaluate. But this is how I tell, because there's a big question. How do I tell if it's GI pain or cardiac pain? And the only way that we can really tell that is by giving an antacid and see if it gets better. If it gets better with the antacid, it was a GI problem. If it doesn't get better, it's a heart problem. So they can chew that Tums really quickly, and we can find out pretty quickly what's going on. So I'm going to administer that PRN order of the calcium carbonate and go from there. All right, that's it for this questions. I hope they were helpful. See you next time.